The patient that we'll be looking at today, Renisha, has a history of a physical injury, having fallen from a ladder, and she's been prescribed opiate pain medications to help with pain control. During this time, she's increasing her use of pain medications and also has gone to additional prescribers to get pain medications prescribed for her. She has also been prescribed medications for anxiety, a benzodiazepine, and is taking that along with the opiate pain medication. She presents today for her appointment after having run out of pain medication and having gone to another prescriber. The prescriber that's meeting with her has looked at the PDMP, the prescription drug monitoring program, and now sees that she's gone to additional prescribers for pain medications as well as for benzodiazepines. Now we'll take a look at her case. Hi, Renisha. How are you doing today?
I'm good.
Tell me about how things have been going.
Fine. I just still having some pain from my fall a few years ago.
Okay. How would you rate your pain today from a scale on 1 to 10, where 1 is no pain, 10 is the worst that it's ever been? What would you say your pain is?
I would say usually like an 8 or a 9.
Okay. 8 or 9 from day to day? All right. So it sounds like your pain isn't really under good control right now.
Yeah.
Okay. And are you still taking your opiate medication to help with pain?
Mm-hmm.
How often are you taking that?
I would say probably every day.
Okay. And during the day, how many times a day are you taking your opiate pain medication?
I would say like twice a day, but it's been getting bad, so we moved it up to like 4.
Okay. Originally, we had just prescribed the medication for you to take twice a day. Can you tell me more about when it's increased to up to 4 a day?
The pain just started getting really bad, and
Mm-hmm.
I just couldn't tolerate it, and so that's when I started taking more.
Okay. Okay. About how long ago has that been?
Say like a month or so.
A month or so? Okay. And so in this last month, you've gone from taking the opiate medication from twice a day to about 4 times a day, you said?
Mm-hmm.
And even at 4 times a day, is your pain, you said, is rated at about an 8 or a 9 out of 10 still?
Mm-hmm.
Okay. All right. That concerns me because that tells me that the medication isn't really controlling or assisting you in your pain. One thing I also noticed is that when we were reviewing your chart and record, there's something called a PDMP, which is the prescription drug monitoring program that helps us to see how clients are taking their medications. I noticed at that time that you had also gotten a prescription for pain medications from another provider. Can you tell me about that?
Yeah, I just ran out, and so I got some more.
Okay. Now, tell me about what happened when you said you ran out of your medication.
I just started feeling, like muscle aches and nauseous and diarrhea, and so that's why I needed to get some more meds.
Okay. Okay. That certainly lets me know then that what we're doing right now for your pain isn't really working, because that's a signal when you had those symptoms, the muscle aches, the nausea, that's actually called withdrawal from opiate pain medications. So that tells me not only is the medication not really helping with your pain, but also that your body and your brain are getting pretty dependent on that medication. When someone doesn't take an opiate pain medication, you can get those types of symptoms, those types of withdrawal symptoms. Was that the first time that you'd had that?
Yeah, I would say so.
Okay.
Mm-hmm.
Okay. That really concerns me. We want to be able to help you in managing your pain, but we're concerned about when clients may take too much of their pain medications or when they may go to other providers to get pain medications because of this. Opiate, if it's okay if I give you some information about opiate medications, opiate medications over time, just as you said, your brain can become more and more used to them being in your system, so they don't control your pain as much anymore. But additionally, when you don't take them, your brain and body will miss them, and that's those withdrawal symptoms that you feel. The concern that we as prescribers have with that is that sometimes clients may take too much of their pain medications, and that can decrease their breathing rate to the point where they overdose. Tell me what you think about that.
I guess that makes sense. But yeah, it was just a lot of pain that I was going through.
Okay, I can understand that, and I certainly want to be able to help with pain for you and help in controlling your pain symptoms. The other thing that I noticed with the PDMP, or what we saw in the pain monitoring program, is that you had also gotten a prescription for a benzodiazepine, or a control medication for anxiety at that same time.
Yeah.
Tell me about that, and when that was filled.
It was around the same time.
Mm-hmm.
Yeah, I just been getting really anxious.
Okay. Tell me about your anxiety.
It's just I get this feeling of like shakiness and lots of heavy breathing and yeah.
Okay. I know a few months ago when I had seen you a while back, we had talked about some of those same anxiety symptoms. I think at that time you were telling me that, your heart would be racing or you get really shaky. And we talked about going to talk to the behavioral therapist to help with some anxiety symptoms. But I saw from your record that you weren't able to follow up with that appointment.
I just really don't feel comfortable talking to anyone about my problems, and I just feel like the medicine was a better resource for me.
I can certainly understand that, talking to someone new that you haven't met and kind of getting comfortable, feeling comfortable talking with them. One concern that we do have about medications such as benzodiazepines, though, is just like we were talking about how the pain medications, little by little, the more you continue to take them, the more you might need to take them to help with your anxiety. The same thing happens with benzodiazepines. We want to be able to look at addressing not only your pain issues, but also the anxiety symptoms that you have, because unfortunately, one thing that we do worry about when you take a medication, an opiate medication for pain, as well as a benzodiazepine, that actually increases your risk of accidentally overdosing. What we like to look at doing is helping clients who may have issues with pain, as well as issues with anxiety or mood issues, because we know that they actually work together. Tell me what you think about that.
That sounds good, but I'm just really nervous, about getting away from.
I completely understand. One of the things that we found that's been really helpful and has a lot of research backing in study is that there are medications that can help with pain, but also can decrease the risk that you can overdose on them. And so that they can help when people become kind of dependent with their brain and body on medications that are opiates. It's a medication called Suboxone. It's actually in the same class of medications for opiates for pain, but it has less of a risk of overdosing on that medication. And so when we have clients that become kind of physically dependent on their opiate medication, what we encourage is that we look at transferring them over to the Suboxone, because the Suboxone medication has a less risk of overdose, but also it can help with your pain monitoring as well. I think another important thing will be that we can work together, and the team can work together with you to help in monitoring your pain. And in that way, that's addressing your pain concerns and the real concerns that you would have about not taking the pain medication that you're on currently, but also looking at having a safer method of helping you. Tell me what you think about that.
I hear what you're saying, but again, I really depend on them.
And I think those are exactly the words what you just said.
Yeah.
Your brain and your body have become dependent on the pain medication, such that it's now a risk of your accidentally overdosing on the medication. Okay? We want to address your pain, but we also want you to be safe, and we don't want you to accidentally overdose. Okay. And there's so many people, unfortunately, that get to that point where, like you said, if you don't take the pain medication, or maybe not even taking more, it isn't even controlling the pain even more. But unfortunately, your risk of accidentally overdosing is even worse. So what I'd like to look at offering is a way to look at addressing your brain and body's dependence on that opiate pain medication, as well as looking at how we can help with pain. And I think in that way, we'll not only address your concerns about the pain medication, but we'll also address your pain in a way that'll be much, much safer for you overall. In this interview, my approach to this case was to meet the client where she's at, to acknowledge the pain symptoms and report as well as the anxiety symptoms, and also to provide educational information through SBIRT and motivational interviewing about the potential risks of both opiate pain medication use and the increasing tolerance and dependence that she's developed, as well as the benzodiazepine use, and how both of those together can increase her risk for overdose. So my approach to this case was, one, acknowledging her current symptoms, providing education for her regarding the potential risks of those medications, and as well to offer her some appropriate treatment options that would be effective at addressing not only her pain control, but also anxiety, as we know that both of those issues together can exacerbate both symptoms. It's normal when you discuss any type of change in patient care that clients can become anxious. So you want to address that using shared decision making and providing options for care, and allowing the client to recognize that they're in charge of their care decisions, and providing them good information, education, and what the potential outcomes would be for making changes to their treatment plan. This can decrease some of the anxiety that's normal with any type of change and provide them a foundation on what the next steps will be, so that they're aware of what to expect when they may look at change, how you'll be partnering with them in that change, and how there's an active process to make sure that as they're making changes to their plan of care and treatment, that you're there with them, providing them a level of care that will make sure that you have good outcomes. Hi, Renisha. How are you doing today?
I'm fine.
Tell me about your pain. How's that been going?
Still have it.
Okay.
Yeah.
How would you rate your pain from 1 to 10? 1 is no pain, 10 is in the worst pain that you've ever had.
I would say it's like an 8 or a 9.
Okay. Well, I wanted to talk with you because I was looking on what's called the PDMP, the Prescription Drug Monitoring Program, and it looks like beside the pain medication that you've been taking from me, that you've been getting pain medication from other providers too. Tell me about that.
Well, I've been in a lot of pain, and so I needed to get some more medicine.
Yeah, but you know, when you're getting pain medications from more than me, that's not safe. And we need to talk about you going to rehab or doing something to get off these pain medications.
Wait, you want to take me off these medicines?
Well, it looks like, I'm looking here on the PDMP, and it looks like besides me, you're getting up pain medications from other providers. So that's not safe because you can kind of overdose on those medications. So I'm going to have to stop providing those medications for you, but I'm going to give you a name and some numbers that you can call for rehab.
You're not going to just take me off my pain medicines. Why are you even looking up on this? Like, why are you checking up on me?
We have to do that for all clients to make sure that they're not doctor shopping. And I'm looking at this, and you're all over doctor shopping. So we're going to have to do something about this because you're addicted to these pain medications. I'm going to give you a number for rehab, and if you want to go to rehab, they'll detox you from the pain medications and then look at what else they can do to help. But I can't prescribe you these anymore.
I'm not addicted, okay? I'm in pain. Have you ever experienced this kind of pain?
You know, that's not my problem, but what I can do...
It is your problem because you're supposed to help me.
I am trying to help you by giving you this rehab number because I'm not going to be able to prescribe pain medication for you anymore.
I don't want your little number. I want you to prescribe me my pain meds.
What I can do for you today is give you this number here, okay? They can look at detoxing you from these pain medications because it's not going to be safe for you to take these, and it's certainly not safe for me to prescribe them to you with my license on the line. So you can call this rehab number, and they'll get you some help in getting you off the pain medication.
Sounds like all you care about is your little license. If you could just give me my medicine, and then I'll be fine.
Well, here's the thing. You're taking too many of these medications. You can overdose on them, okay? So I do care about you because I don't want you to overdose. So what I'm recommending is that you look at going to get some rehab so that you can get off the pain medications. That's the best I can do for you today.
If you care about me, then you'll give me my meds.
I care about you not overdosing, so I'm giving you this rehab number. That's the best I can do.
I don't want your number or this little rehab number. I want someone to give me my meds.
Then you're going to have to go somewhere else and get them.
Aren't you a doctor?
Yes. And my job is to make sure that you're safe and you don't overdose on my pain medications that I prescribe for you. So I'm not prescribing them for you anymore. If you want to go to somebody else, to go to one of these other doctors, you're welcome to do that.
Yeah, I'll do that because obviously you don't care about your patients.
Well, you can say that, I understand, but when you're addicted to the pain medication, it's the addiction talking. I really think you need to go to rehab, okay?
I'm just going to go to someone else who cares.
Well, suit yourself.